I'm Styx with Empire Surgical. This video I'm going to describe some basic steps of a rotator cuff repair. For this example, I'm going to use the double row technique, the medial row being a double-stranded Healix anchor, and our lateral row will go with the Versalok anchor. So our first step with any rotator cuff repair is establishing our portals. In this case, we'll make an anterior portal, an anterior lateral portal, a lateral portal, and then our viewing portal, where we'll insert our arthroscope, will be on the posterior side. We'll insert that about 2 centimeters inferior and 2 centimeters medial of the acromion. So once we get our scope into the joint space, we're going to probe around and look at the rotator cuff, trying to identify a tear. We'll first enter into the glenohumeral joint space, then we'll go to the subacromial joint space and get a look at the rotator cuff from above. See if you can identify the tears. Once you've done that, it's time to go in there with a grasper. You want to grab onto the tissue itself, try to pull it. Most of the times it's going to be retracted medially away from the articular margin or greater tuberosity where it attaches. You want to make sure you have enough movement of the cuff to pull it back to that anatomical footprint where you want to anchor it. So if you have enough movement, then you're going to identify the spot at which you'd like to set your anchor. Our first anchor is going to go on that articular margin. We'll take a rasp and create a bloody bed. So when we eventually tie the cuff down to that bloody bed, that's going to promote a lot of healing. Once we've identified that spot, it's time to use our universal awl to mallet a hole in which we can screw in our Healix anchor itself. So assuming that we can do this through a cannula that's already established, if not, we'd have to go percutaneously. But assuming we already have that, we'll insert the universal awl. In this case, we'll use a 5.5 millimeter Healix anchor. So we'll take our universal awl and tap to the 5565 laser line, which is just above the shoulder on the universal awl. Once we have that hole, remove the awl, and it's time to take the Healix inserter, push it down into that hole, and then just screw it in. The Healix anchor is threaded. 5 threads will go into the cancellous bone, 5 into the cortical bone, and that should create plenty of strength to prevent pull-out. At this point, the inserter rod, you can take the handle and remove the sutures from the handle, pull them up, and then pull the inserter rod directly out. You'll then be left with, in this case, a double-stranded. You'll have 4 suture strands anchored into the bone and out, let's say, the anterior portal. Next thing to do is pass those strands through the cuff. So assuming that all 4 strands are out the anterior portal, we'll go in with the crab claw through our lateral portal, grab one of the strands, and pull it out laterally. We'll then load that into our espresso, which is going to be our suture passer. Load that top down with a little tail, about a 2 centimeter tail out the bottom. Close the ratchet, insert it in down the cannula, the lateral cannula again, open the jaw, and grasp onto our tissue. We'll start as anterior as we need to be. So when we're viewing posteriorly, we want to start passing our sutures at the anterior side. When we're in position, we're going to deploying the needle. It's going to push the needle up through the tissue along with the suture. At this point, you want to come in through the anterior lateral portal with a suture grabber. Again, the crab claw can be used. Grab onto that suture strand that's been passed through the cuff, release the ratchet, and pull the strand out of the joint space. You're going to do the same technique for all 3. In this case, we want to do a mattress stitch, which means we're going to pass both strands of each suture through the rotator cuff itself. So again, we're going to work anterior to posterior to pass these suture strands. Same technique with the espresso. Once all 4 strands are passed, it's time to tie them down. So they're again coming out our cannula. You take the light colors, purple on purple, blue on blue, tie those down. You're going to be left with 2 knots, anterior and a posterior knot. They're going to tie the rotator cuff down to the articular margin and the bloody bed, which we made with the rasp earlier. At this point, that will consist of our medial row. Now we want to make our lateral row using the Versalok anchor. So we take the strands that are left hanging off of the knots that have been tied, we pull them out, and we're going to load those into the Versalok. The Versalok has a loader tab, which kind of looks, when you look at it above, it looks kind of like a butterfly. It's 2 white, labeled left and right. You want to put the light-colored suture strands in the left and light-colored on the right, and you're going to pull that tab down. That tab's then going to pull the suture strands through the anchor, threading the anchor. We're now ready to use the anchor to tap or mallet into our greater tuberosity and establish our lateral row. So we'll go back down through the cannula, This anchor is self-tapping. There's no need to use an awl to create a hole. We're going to put that into the place on the greater tuberosity, and then we're going to mallet it just to the point where the sutures are about to enter into the bone. At this point, we're going to grab the sutures and create some tension on there, and then mallet the anchor the rest of the way in with the inserter to the laser line. We're now ready to unscrew the top of the inserter, and we're going to take the Versalok gun. The Versalok gun is going to engage the actual anchor and cause it to expand and really fix it inside the bone. So when you're ready to do that, you take the Versalok inserter gun, make sure it's in the unlocked position, push it down the inserter rod till it meets the shoulder. Then you're going to lock it into place, and with the downward pressure, you're going to pull the trigger of the gun, and that's going to create the firing mechanism, which is going to expand the anchor within the bone itself. At this point, you can unlock and remove that gun. Then you can unscrew the inserter rod, and you're going to be left with a double row. You're going to have the medial row with the Healix, and then the Versalok anchor on your lateral row. You can use a cutter to cut the excess strands away, and that's pretty much the basics of the repair. So again, Healix medial row, Versalok lateral row creates your double row for your rotator cuff repair. I'm Styx, with Empire Surgical.